Bismillahirrahmanirrahim. Thank you, moderator, for warm welcoming, respected chair and learned audience. Assalamu alaikum. I myself, Dr. S.M. Rokonuzzaman, radiation oncologist working in CMA, Dhaka. Welcoming all today's session. My topic is cardiac dose evaluation with the deep inspiratory breath hold technique of radiotherapy for left-sided breast cancer. As you know, breast cancer is the most frequently diagnosed cancer globally and the leading cause of cancer-related death in women. It is the fifth leading cause of cancer mortality worldwide. The lifetime risk of breast cancer for women in United States is 1 in 8 today. According to Globocan statistics, in 2022, we have seen that around 2.3 million newly diagnosed cases globally and highest incidence of cancer with highest mortality rate around 11% in female globally. According to Globocan 2022, in Bangladesh scenario, an annual economic loss of $5.51 billion, which is the second highest among SAARC countries, with an estimated future economic impact of $14.25 billion. Around 13,000 new cancer incidences in 2022, with the highest among all cancer incidents in female. The mortality rate is around 13%. So you know, radiotherapy plays an important role in the treatment of carcinoma breast. While treating breast, there will be some radiation exposures to organ at risk, mainly heart and lung. Several methods are available for reducing the radiation doses to the heart, shaping the treatment fields to avoid the heart, changing the intensity of beam around the heart, and delivering the treatment while the patient breathes in DI-based technique. So what is DI-based? DI-based is an advanced technique. Involves patients taking a deep breath, holding it during the delivery of radiation. Beneficials for patients receiving radiotherapy on the left-sided breast where the heart is the greatest risk of radiation exposure. DI-based reduces heart dose, minimizes lung dose, and improves target volume and consistency. So you know, during free breathing, heart comes to the chest wall, around the chest wall, so it is close to the target of the organs. So what happens in DIBS, it increases separation between the heart and the target volume. As you see in the screen, there are a lot of spaces between the heart and the target organs. So in this regards, we have done a study in our center. The aim of this study is to assess cardiac dose with DIBS to reduce the risk of cardiac complications and improves the quality of life after radiation therapy. We have enrolled 60 patients with left-sided breast cancer, age is around 18 to 70 years, and good performance status, and the place is in Radiation Oncology Department, CMH, Dhaka. We have done 36 DIBS patients with IMRT and 24 DIBS patients with three-dimensional conformal radiotherapy. And you know, for DIBS patients, education, patients coaching, and appropriate patient selection is very important. And it needs real-time position management system, that means RPM system, which should be integrated in linear accelerator machine, as well as CT simulator machine, and with due immobilization, good immobilization, and positioning, we are doing radiotherapy DI-based technique. This study was done in 2013. The article was published in the New England Journal of Medicine, was shown that increased risk of major coronary events by 7.4% for every single gray increase in mean heart dose. So with this, we have compared with several studies around the world with our study with free breathing versus DIBS, where we found that around free breathing, 5.23 gray was, mean dose was 5.23 gray, but in DI-base it comes down to 2.3 gray. DI-base reduces mean heart dose by 56%. So we compared with lung dose with free breathing versus DI-base to other studies and shown that DI-base reduces mean lung dose by 34%. So a systematic review article published in Journal of Medical Radiation Sciences were concluded with DI-base is reproducible and stable technique for the left-sided breast irradiation, showing significant promises in reducing the late cardiac toxicity associated with radiation therapy. So what are the complications happen with this radiation therapy to the heart? It's the coronary artery disease, dysfunctional valves, microvascular diseases, myocardial infections, and others. We have studied and collected the information to other advanced studies that percentage of cardiac abnormality dramatically decreases with DIBS with the comparison to the free breathing. And this is the dosimetric result, and results I will emphasis on this slide that correlation of heart and anterior systole distance is in free breathing it's around 0.46 centimeter, but in DIBS it's dramatically changes. It increases double. The distance between heart and the chest wall is much more, 83 centimeter. So with this, our result comes to the end with this, that they, in DIBS with IMRT intensity modulated radiation therapy, we found the average mean heart volume is around 2.3 gray. And in DIBS with 3D CRT, it's around 3.2 gray. So there are few limitations of our study that we're lacking of free breathing comparison with this study, and modest sample size with we need there are some not suitable tumor locations. And in discussion, IMRT with DIBS enhances accuracy and safety suitable for improving treatment outcomes. DIBS is an important tool for cardiac aspiring and has been reproducibly associated with reduction of mean heart dose. Future studies with long-term follow-up is needed. Careful simulation scan plays a vital role for the radiation planning in DIBS. So take-home messages is appropriate patient selection and coaching are vital for DIBS treatment. DIBS can be successfully implemented with the help of pre-treatment counseling and coaching. Radiation therapist plays an important role in every steps of DIBS treatment process, from patient coaching to treatment delivery. And this then at the whole DIBS treatment process needs a team effort. So this is our team working in CMS Dhaka with radiation oncologist, physicist, and radiation therapist. All of us are very trained and working together for a good radiation treatment. These are the few glimpses of our treatment. This is the simulation with the infrared camera, and I will request you to enjoy the short video of our DIBS technique. Excuse me, sorry, we lost the sound. So this is how the DIBS treatment has been done in our center. With this, thank you all. Wish you a good heart. Thank you so much.